Okay, so teenagers. So the teenage years certainly can be a difficult time for many parents. It's a time when they, the person with type 1 diabetes, are becoming more independent, taking on ever-increasing responsibility for aspects of their lives. There's also first job, social commitments, learning to drive, and other life events. So in this short presentation, I'll aim to frame the issues of particular concern and provide some advice surrounding their management. So it would be remiss of me not to talk about puberty when discussing the teenage years. There are numerous changes occurring to the body which will impact on type 1 diabetes management. Firstly, the sex hormones, estrogen and testosterone. The hallmarks of puberty, they work against insulin. And by this, I mean sex hormones raise blood glucose, thereby generally necessitating increased insulin dosages. For teens who are menstruating, the hormones responsible for menstruation can also cause a rise in blood glucose. Menstruating teens may require more insulin during their period, which you as healthcare professionals can assist with. I have found that many teenagers find it useful to track the menstrual cycle. With a management plan already formulated and to hand, tracking can be helpful in estimating when this might need to be actioned. On top of this, many teenagers experience an increase in appetite, which itself results in higher carbohydrate consumption and subsequently the need for more insulin to be administered. There also tends to be a fair amount of stress during the teenage years, whether this be stress relating to exams or driving tests. Stress hormones such as cortisol also raise blood glucose levels. So all in all, as you can no doubt tell, there's lots going on. So as children with type 1 diabetes enter adolescence, they will need to gradually take over the daily management of their condition, and you as part of the medical team can certainly help to guide and support them. One way to do this is to let them be part of the decision-making process as it applies to balancing lifestyle with insulin therapy, glucose testing, meals, and exercise. Some small bits of information you can impart can be the use of phone reminders. You know, everyone seems to have a phone, or a lot of people do. Storing a checklist of supplies on their phone and, where possible, auto-subscribing to a delivery service so that they don't run out. It's important, though, to keep parents as key stakeholders, and I really do emphasize this. Part of this is because they will likely be feeling stress relating to the transfer of, and I'll use the word, responsibility. Then there's the emotional and social aspects of puberty that can make the management of type 1 diabetes more difficult. The reality is that trying to maintain target blood glucose levels in order to prevent chronic complications of type 1 diabetes 20 to 30 years in the future is frankly not the priority for many. Some just want to go out and party to live now. Some teenagers may, for example, feel that doing a blood glucose measurement is an inconvenience or makes them feel different from their peers, and they may not do it consistently. I have found that frequent communication and explanation around the need for diabetes management here and now is beneficial. That said, this certainly is a tough one. Okay, so now on to some of the issues of particular concern. I'll be brief when discussing these as there's quite a few to consider. So pregnancy, there are many contraceptive options available to choose from. Fluctuations in blood glucose seem to be more likely with combination pills, and as such, some physicians may suggest progestin only or mini pills to avoid this issue. Use of a diaphragm, for example, doesn't seem to affect blood glucose levels, but there is an increased risk of yeast infections. So really, choices of contraception really do need to be individualized. Now, here's the problem. I understand that premarital sex is largely considered a taboo in India, but I'd imagine that it exists. In an ideal world, it's essential that sexually active females with type 1 diabetes work with their gynecologist, endocrinologist, or local physician to find a hormonal birth control that works alongside the tools that they already have in place for their type 1 diabetes. However, because of this aforementioned taboo, there is the possibility that some healthcare professionals may even find it difficult to bring up this topic for discussion. As such, oral contraception may not be an option. Barrier methods will probably or more likely be used, if any contraception is used at all. Any unwanted pregnancies may be hidden, possibly ending up with backstreet abortions. So in summary, it really is essential that the topic of pregnancy and contraception is raised. Certainly in Australia, people with type 1 diabetes can typically hold a driver's license or learner's permits as long as their type 1 diabetes is well managed. Here, say in Australia, a medical report must be provided before a driver's license or learner's permit can be issued by the relevant authority. A report that should come from the person's treating doctor or diabetes specialist. I'm unable to comment on the situation in India. This is despite my searching for information, and I really would encourage you to find out so that you can be better informed. Essentially, the main concern of the licensing authorities is the possibility of hypoglycemia occurring while driving. This is in addition to concerns surrounding or around chronic type 1 diabetes related complications such as retinopathy, which can affect your ability to drive safely. Here in Australia, the slogan "Be above 5 to drive" is used, meaning that you shouldn't drive if your blood glucose is below 5 millimoles. You should only drive when it's above 5 millimoles, and this is a good slogan. As always, the blood glucose should be rechecked on longer drives every hour, and diabetes-related supplies should be available in the car. And in the event of hypoglycemia, naturally one should stop driving and treat accordingly. I understand from colleagues in India that driving isn't always considered in diabetes-related education. You really do need to ensure that patients are educated in this area. Drinking alcohol, that can be particularly problematic for teenagers with type 1 diabetes, as it directly increases the risk of hypoglycemia through its effects in the body. This is in addition to indirectly promoting behaviours that contribute to risk. While it's always preferable that teenagers with type 1 diabetes don't drink, I think we all know the reality is that many will. So on this basis, it's of great importance that they and their friends understand what effects they can expect to occur if they do drink. So the effects of alcohol on blood glucose can vary depending on the content of the drink. This is because different alcoholic drinks contain varying amounts of alcohol and sugar, and as such, they affect blood glucose levels differently. Alcoholic drinks that are sweet can initially raise blood glucose levels. This can give the person with type 1 diabetes a false impression that they need more insulin or are not at risk of hypoglycemia. Alcohol does, however, increase the risk of severe hypoglycemia through various means. It can mask the early signs and symptoms of hypoglycemia and lead to confusion, which may affect a person's ability to manage hypoglycemia. Further, it inhibits stored glucose release from the liver into the bloodstream and reduces the ability of a glucagon injection to reverse hypoglycemia. It can even delay hypoglycemia until many hours or even a day after drinking alcohol. They may forget to take their insulin as required, for example, or others may even mistake the signs of hypoglycemia for simply being drunk and not come to the aid of the person with diabetes. So to reduce risk, it's quite important that they be with someone who knows they have type 1 diabetes. So really the benefit of your friends here is quite important. Someone who understands the signs of hypoglycemia and how to treat it, that they eat some carbohydrate food before drinking alcohol and every couple of hours while they're out, then before going to sleep. It's also important that they alternate between alcoholic and non-alcoholic drinks and choose low alcohol drinks in preference to those with low carbohydrates. They should also carry hypoglycemia treatment and testing supplies at all times, test blood glucose, especially before bed, and continue to monitor the next day to detect hypoglycemia. So they may need some assistance from a trusted friend or relative with some of these tasks. Smoking, well, the simple response here is just don't do it, full stop. There is no safe level of smoking. You don't need me to tell you that it increases the risk of serious health problems associated with type 1 diabetes. Smoking can also increase blood glucose levels as tobacco causes insulin resistance and stimulates stress hormones. Really, they just shouldn't do it. Just use whatever resources you as healthcare professionals have available to help people stop smoking. Illicit, or should I say illegal drugs, are another no-do. Again, you don't need me to tell you about the significant damage to health that they can cause and that they can cause death. For people with type 1 diabetes, taking drugs can result in poor glucose control, poor self-care, and an inability to recognize hypoglycemia and hyperglycemia. Despite this, many teenagers will still partake in illicit drug use, as I'm sure you know. It's hard to give exact advice since drugs will have different effects due to impurities and differences in composition. However, to reduce the chances of harm, the person with type 1 diabetes should be encouraged to be alert to signs of hypo and hyperglycemia. Drugs may alter their ability to recognize symptoms. They should make sure that some of their friends, so the importance of friends again, know about their type 1 diabetes and are aware of the signs of hypoglycemia and know how to help them. Hypoglycemia treatment should always be carried. They should be encouraged to stick to their normal diabetes routine as much as possible, or always take their insulin and maintain regular eating habits, and to test their blood glucose levels regularly to determine the effect of a particular drug on their body. They should also drink non-alcoholic fluids to stay hydrated. Thank you.